Sarah, back along here. And then at the bottom, we're going to get some knuckles, some condyles, medial and lateral condyles. So up here, only here to see the better picture. So here we go. So here's greater trochanter. The lesser trochanter is on here someplace. Oh, there it is. Lesser trochanter's there. Here's the neck. Here's the head. Okay, and it's got a little hole in here, right? And this is called the fovea. There's another stupid one in anatomy. This used to be called the fovea centralis because there's a ligament that fits in here that holds the head of the femur in the acetabulum. But they decided to change the name of it, and now it's called the fovea for the ligament of the head. I'm just going to call it the fovea, right? It's this depression right here. There's a ligament that goes in. And so, pretty cool structure. And then we go down to the end, and then we've got condyles down here. We've got a medial condyle and a lateral condyle, and the condyles are these knuckles right here. And these are going to help form the knee joint, right? Okay, now you guys need to know this. And it's easy. It's like, so look, it goes this way. This is a left femur, right? So which one has to be the medial condyle? Well, it can't be this one, because this is lateral, right? It has to be this one. This is the midline of the body. This is the medial condyle and the lateral condyle. And there's a big bump right back here in the back that helps form the knee joint, which is labeled on here. Same. It's femur. Lots of stuff to look at in femur. All right, last two. All right, goody. The big weight-bearing bone in the lower leg is the tibia. The tibia is your shin bone. All right, this is a left because of this medial malleolus. All right. So these two things come together like this to form the knee joint, which is a hinge joint, right? And there's cartilage on there, right? That does that, forms that joint. All right, so here's the tibia. Right here, it's right under your skin. That's why it, if you want to try to disable somebody pretty quickly, kick them in the shins, because if you've ever. We've done that. I mean, you run into a table or something like that, you hit your shin on something, it's like, okay, yeah, that hurts. Okay, so this is it's not your shin bone, it's your tibia. Another feature that you can feel is right here, the tibial tuberosity, which is the bump. So here's your kneecap, the bump right here. It's this bump, tibial tuberosity, right here on the tibia, right here on the front. And then we go on down the shaft. We've got this thing, the medial malleolus, which, as you'll see in just a second, helps form the ankle joint. You can actually kind of feel it, kind of down here, bump sort of down at the end of your leg, is the bump here, the medial malleolus. And then there's a little, your book doesn't have it, but it's in the study guide. There's a little depression right here, okay, which is the, the book doesn't show it, but it's the, here's the and the articulate one, this is not going to work. But anyway, so, it doesn't work. It's not long enough. But this is one end, and this is the other end upside down. So this is the distal end of the fibula, and it articulates in like that, right? So I'm going to hold these together the best I can. And I'm not going to do a very good job. But anyway, so this bone here is the tibia. And this is the medial malleolus of the tibia. This non-weight-bearing bone here is the fibula, not fibia, fibula. And it's also, at this end, you can see it kind of has like a little flaring bone down here. It fits right in this little groove on the distal side, the lateral side of the tibia. And so this is the medial malleolus of the tibia. This is the lateral malleolus of the fibula. And these two things together kind of help form the ankle joint, which is going to start right here. So this is at the distal end. So, ouch. Sorry, getting old. My saddle joint. So down here we're going to form the ankle joint. Up here we form the knee joint. But the fibula is not at all involved in the formation of the knee joint. It's just the tibia. Down here, they both help form the ankle joint. So they kind of come together like that. Again, it's lots better if you got like something that matches. Like a skeleton or something like that. But this is a non-weight-bearing bone, but yet you got to have one. If you were born without fibulas, you can't walk. There's a
there was a real inspiring story I saw in a magazine a few years ago about, she's actually, well, she's an older woman now, I guess, but she was like a Division